It's time for our daily coronavirus virtual town hall here on Channel 2. Thanks for joining us on this Tuesday, everybody. I'm Michael Wooten.
And I'm Mary Alice Demler. Ahead for us today, we answer your questions about which businesses are in which phase of the reopening here in New York State.
Plus, you've been asking us about elective surgeries in our region outside Erie County. We got some answers on that today.
And we've been reporting on a troubling condition showing up in kids that's linked to COVID-19. We answer your questions on whether or not we are seeing that here in our area. But first, the three things you need to know right now.
At number one, worldwide deaths from COVID-19 have now passed the 250,000 mark, according to Johns Hopkins' running tally. Experts believe the number is even higher than that due to underreporting in a lot of countries.
Number two, the Erie County Health Department is again expanding testing. You no longer need to be experiencing symptoms to get a test. You qualify as long as you think you've been exposed to someone else who was sick or you believe you are at risk for the virus.
And number three, earlier this hour, we told you about the Summer Canalside live concert series getting canceled here in Buffalo. Well, now we've learned the Buffalo Philharmonic Orchestra is suspending the remainder of its current 2019-2020 season. A shortened summer series for the BPO may start in August. We'll see.
Well, our first question is a common one regarding the reopening of the economy. Here in New York State, like everywhere else, there are phases, but what's included in each one?
Yeah, one viewer asked us, I am an independent stylist and the guidance from the state doesn't expressly say which phase my business falls into. Now, that's true. There are a lot of questions, so we want to walk you through what we know about all this and what we don't know.
Well, first up, here's phase one. Now, this would allow construction and manufacturing to continue, as well as some retail stores that close to reopen for curbside pickup only. Now, the earliest the first phase could happen is May 15th, if that particular region hits the metrics that are laid out by the state.
If things go well there, a region could enter phase two, and that would include professional services like law firms and some other businesses, finance and insurance, the rest of retail, administrative support, and real estate. That would include buying and selling houses and also renting.
And that would then bring us to phase three, which would allow dine-in restaurants plus hotels, although they were already deemed essential and many never closed.
And then you would have the fourth and final phase when arts and entertainment venues will be able to reopen, as well as public schools, really all schools. The governor and his team have said that this phase is likely months away from happening.
Now, you'll notice what is not on these lists. Barbershops, hair and nail salons, and gyms. Those are not being classified yet. All we know is that they will not be part of the first phase. Clearly, some of the specifics are still being worked out.
Yeah, some other states are obviously moving faster with dine-in eating already allowed in some places. And some people will disagree with them, but Governor Andrew Cuomo made the case today on why he believes this slower approach is better.
How many more deaths are you willing to sustain to reopen quickly? 100 more deaths? 500 more deaths? Because there is a cost of reopening. There's a cost of staying closed. There's a cost of reopening too quickly. So let's be honest about it. It's a trade-off. And say to the American people and say to the people of the state of New York, we can reopen tomorrow if you want to reopen. This is how many more people will die. IHME model says they adjusted it from 60 to 134,000 nationwide based on what 31 states are doing. If you're okay with that, you're okay with that. When will we reopen? When it's safe. You tell me how fast that line comes down, how fast the decline. I'll tell you when we reopen.
Michael, it is something that the governor has made clear. He doesn't want any more deaths than, I don't want to say absolutely necessary because there's no such thing, but he just does not want them on his conscience.
Yeah, and these are difficult decisions, and every state is doing this differently. This is the system that we have here in New York State. But as the viewer pointed out, there are still some categories of businesses that we're unsure about. So this is something we're going to be covering a lot, I have a feeling.
Yeah, we'll keep you all posted on that. Well, we've also gotten a lot of questions about elective surgeries now that they're allowed across our region, except in Erie County. Now, specifically, someone texted us this: what kinds of elective surgeries are now available in Niagara County and elsewhere? Are they even happening yet? And when will Erie County doctors be able to do these? Well, the last part is difficult to answer because Erie County has not been given the green light from the state.
Yeah, we'll let you know when that changes. But as to the other part of that question, we got an update today from Catholic Health, which runs Mount St. Mary's Hospital in Lewiston. And here are the numbers. In the first week of resuming these types of services, so it's April 28th to May 2nd, there were 45 elective surgeries at that hospital, plus 16 gastrointestinal procedures. Now, all of that is going to be continuing with more surgeries and more procedures getting scheduled soon.
Mount St. Mary's Hospital put together a team to get ready to resume these surgeries. We get an update now from a couple of those key people, including that specific answer to the question in terms of which surgeries will be first.
We're starting off with uncomplicated elective surgeries, outpatient surgeries, things that can be performed and then the patient can go home the same day, or they don't have to stay overnight in the hospital. So that excludes things like total joint replacements or extensive abdominal surgery, neurosurgery, vascular surgery, basic things like hernia surgery, gallbladder surgery, these kind of things. Patients can come in and go home the same day.
There is a backlog that all of our surgeons throughout the system have. They tend to pre-schedule sometimes months in advance, and of course with COVID that all sort of was put on a pause. So we have now asked them to go back and triage that backlog and to see what patients are still interested in getting their surgeries in some cases, and of course also understanding that some patients are going through some economic hardships. They may have lost their jobs, they may have lost their health insurance, and we may have to work with them to get their procedures done. So that's all happening in the background to build the new list, and as well as those folks that are ready to go and those surgeons that are ready to go to get them on the schedule as soon as possible.
We have a new testing procedure. Our patients all have to be tested for COVID-19 before they're allowed to have elective surgery here. And after that is done and they come back negative, then they can undergo their preoperative blood work, chest x-rays, EKGs, see their primary physician, and then have their surgery within 72 hours.
A lot of people are glad to see some of this is resuming. Now, you're looking at some video that Catholic Health shared with us from inside Mount St. Mary's. The hospital discharged its last COVID-19 patient on April 17th, so it's been a while with no positive patients, none there right now. But you know, to check, you heard the doctor there talking about the testing procedure that is in place. They're on top of it. And the bottom line is really that the administrators there and at all of our hospitals, Mary Alice, want people to know that it is safe to go to a hospital.
That's right. There were people that were delaying what really should have been considered emergency situations. If they're having arm pain that could be connected to a heart attack, for example, people were putting off, which of course is not safe at all. But those surgeries that he was talking about, you know, the gallbladder surgery and hernia surgery, I mean, those are surgeries that could lead to serious complications if people do not have them done. I'm assuming that's why they're on the list, and because obviously, first and foremost, they can be done on an outpatient basis.
Yeah, they call them elective, but they are quite serious and necessary, no doubt. Let's turn to a question right now that is regarding those stimulus payments we've talked so much about. A man named Ed emailed us and said, I received a stimulus check addressed for my mother who passed. The letters DCSD were next to my mother's name. Then the second line read my name. Her estate return was done in 2019. I understand there is no clawback provision in the CARES Act. What is the best way to return the check so it doesn't get lost in the system? So Ed, we've probably heard from more than a dozen people in your exact same situation, and there are a lot more than that all across the country. And this is a look at one of those checks. You can see DECD, those letters right there on the check, they seem to indicate that the government knows the person is deceased. So you wonder why these checks are getting sent out. What are you supposed to do? No real clear answers yet on all this. Reporter Kyle Aboshi has been extensively covering these stimulus issues from his home.
I talked to a tax lawyer today, also a professor, and he said, listen, it's really a gray area here. It's not clear what to do. So his advice, just hold on. Don't mail that check back to the government, at least not yet. Also, if it's direct deposit, don't go out and spend it. Wait for the dust to settle. There'll be clear directions later on. Then you'll know what to do with the money. But for now, just hang tight.
Yeah,
Easier said than done, right?
I know. It gives a lot of people anxiety, especially older folks from a certain generation who are so mindful about their money. And, you love to see that. But at the same time, they can just relax and hold on to it. If you don't cash it, you really don't have anything to worry about. That's really the best thing to do. Nothing in this scenario right now.
And as soon as we hear from the Treasury Department or the IRS, we'll pass that along.
We will.